Hi there, I'm Carolyn, trichologist here at Absolique Hair Health Clinic. We're just going to go over a little bit about what we actually do here today, and that we always start with a correct diagnosis, and that includes I use my microscope and we use this type of imagery, and the reason being is we need to sort of really understand the underlying causes of, whether it's hair loss, hair thinning. A lot of people have a lot of perceived ideas of what they think is going on compared to what is actually going on, and I get emails all the time asking for help, and honestly I can't really help unless I have the microscopic images, or at least a consultation service as well. So we start with imaging in the back of the head. Okay, so the terminal area is the strongest, thickest area of hair on the head, and it's completely away from anything that's related to pattern thinning. So we need to understand this area first. So particularly for hair loss, hair falling out, you will see it in this area. Or for what we call diffuse hair thinning, which you can see with this picture here, I can see the normal hair strands, how they should be growing, and then these overlapping hair strands that are not structurally growing properly. So that represents the entire scalp diffusely. So then I would use the consultation service that comes with our microscopic service, and we try and uncover, has something happened in the past that could have disturbed the hair cell, the hair cycle, and we lean on blood tests a lot as well, because that gives us a health perspective and nutritional levels, because there are certain levels required to grow hair. So all the time I get these emails saying, I've got female pattern thinning or male pattern thinning, and when I really get in, consult, and the service we call this is a hair health and scalp check, I actually find their problem is low ferritin or something like that. So it is really important, if you're trying to deal with hair loss, hair thinning, bald patches, and even scalp conditions, that you have a microscopic diagnosis so the treatment can be individual to you. Or if you've been trying to deal with these things for more than a year or two and you're not getting a result, you really do need to get a correct diagnosis from a trichologist who understands how to use what they call dermoscopy. Okay, so this is the microscope, and we're really going in at different levels of the dermis. The other thing I can see in this picture here is the oil glands, and we find, yes, it's related to an overactive oil gland, but it's also related to vitamin D deficiency, essential fatty acid deficiency, and we teach people whether they need to use scalp treatments or particular scalp products, and there's many treatment options available. So the hair health and scalp check always starts with a correct diagnosis. It takes 75 minutes and the cost is $225. Now I do it in person here in Brisbane in Australia, but we can also show you how to do it all over the world, where you get your own little USB microscope, and I show you how to take the images that I need, and you do this thing called email. You email them to me, and then we Skype. So you just email all the information across, and it is no different to being in person, and we get the same outcomes. And then we can give you treatment recommendations. So again, I get asked all the time to recommend certain products. I can't recommend a product if I don't know what your scalp condition is, what your hair problem is. So we do need to be accurate, correct diagnosis. So generally, once we know what's going on, we'll offer some treatments. I try and get you to learn how to do all your treatments at home. It makes more sense, as in frequency, to get a better result. We teach you how to do all of that through in-person program inductions here in Brisbane. We have an organic hair salon where we can teach you how to do it. For our interstate and overseas clients, we use Skype to talk you through it, and we've got written instructions and also video instructions. Now sometimes if we find there's deficiencies or the hair's seriously not growing properly, we might use nutritional programs as well, and we would go through recommending all the different things which we email to you, or we give you the brochures here in clinic. So price wise, I don't know what you need until I have a diagnosis. So some of our simple treatment can start from $180, but if you're doing, like, if someone's got everything wrong, then what they need might cost them $2,000 for 4 months. Treatment time frame is 4 months as well. So understand, it's really difficult to me to answer those questions for you without a correct diagnosis. So no matter what is wrong, you may not even need any treatment. You've got to get a correct diagnosis. So for anyone, that's the first step. Hair health and scalp check here at Absolique Hair Health Clinic in Brisbane, $225. I do offer a free 15-minute phone chat or Skype chat if you have any questions before booking the appointment, so please do reach out to me. Any questions, as always, it's info@absolique.com.au.